That was about a little over 3 years ago.
Wonderful. Let's see here. And Carolyn? Can Carolyn figure out how to unmute herself?
Hi, can you hear me?
Yes, we can hear you.
Oh, okay. I'm a nurse practitioner in New York City, and I've been working on single payer for 7 or 8 years with PNHP and Healthcare Now and Healthcare for the 99%, and I'll be in DC on the 22nd.
Great, welcome. The next person I see is Lynn.
I'm Lynn Moses-Yellett in Shepherdstown, West Virginia. We started the Eastern Panhandle Single Payer Action Network, and we're a chapter of PNHP about 6 years ago. And I actually was working on single payer back in the 90s also.
Wonderful, great. Thank you for being here. Raymond?
Yeah, Raymond Saul from Portland, Oregon. I'm a retired attorney. I was involved with single payer 6 or 7 years ago, and now I'm getting back involved again for the last year or so.
Great. And then there's two Davids. David Ball.
Yeah, hi. David Ball, co-founder of this chapter of PNHP for South Carolina.
Great. I think we lost you, David.
Okay, let me try it again. Can you hear me?
Yeah, now we can.
Okay. David Ball, I'm a co-founder of the South Carolina chapter of PNHP and working on single payer since 2009.
Great, wonderful. Barbara?
Hi, this is Barbara from Portland, and I originally found out about single payer, I'd say about 6 years ago, and began working on it, and been working on other issues, and now I'm back working on single payer for care for all Oregonians.
Great. And then another David?
Yes, my name is David Holsager. I'm a pediatrician in Southeast Virginia. I've been a supporter of a single payer idea since my father was in pediatrics in the 50s and 60s. But this is the first time I've actually gotten involved with the PNHP, although I've been a supporter for about 6 or 7 years.
Great. Well, thank you, everyone. I'm going to open up my chat bar here. So great. It's great to have people from all over the country and who've been doing this for such a very long time. First, I'd like to apologize. I have a cold. I decided to celebrate Minnesota's long winter by getting a cold as soon as it got nice here. As I mentioned, I'm the newly hired executive director for PNHP Minnesota. I started in February. And I'm relatively new to the single payer movement, so there's certainly a lot more expertise on this call about the ins and outs of single payer than I certainly have at this point in time. What I do is I've come from a background in issue advocacy. Primarily, I've been working in the lesbian, gay, bisexual, transgender movement, most specifically on the issue of marriage here in Minnesota. And I've been doing that on and off for the last 13 years. And one of the things I have done while in the course of this work is to put on very, very large lobby days at our state capitol. When Michelle Bachmann was then just a little state senator, she introduced a constitutional amendment to ban same-sex marriage here in Minnesota, which really galvanized the GLBT community here. And one of our largest lobby days had 1,000 people in Minnesota signed up to meet with their legislators. So we coordinated that, we trained people, we sent them off to meetings, and it was a hugely powerful time in this state, and I think it was one of the reasons that Minnesota later became the first state to defeat a constitutional amendment that was put on the ballot. But in addition to that work, I've also was a legislative staffer for State Senator John Marty here in Minnesota. He was our single payer champion and the author of the Minnesota Health Plan, which is our version of the single payer bill. And since being with PNHP, I've coordinated a lobby day for our doctors and other healthcare professionals here in Minnesota. So what I'm going to talk about here today is really what I've learned through the experiences I've had, both in movement politics, both as a citizen lobbyist, my experience working as a legislative staffer, and my experience working for Minnesotans United for All Families, which was the campaign that worked to defeat the marriage amendment here in Minnesota. That was really the largest grassroots campaign that Minnesota had ever seen. All that said, I'm not an expert. There's so much room. I think, you know, lobbying is an art, not a science. So I'm anxious and open to having everybody comment and bring in their own experiences to this conversation. And I want to thank everyone who submitted comments when they registered. They were really helpful in my preparing for today, and I'm sure with the collective wisdom on this call, we can tackle most of those questions and concerns that you have. In particular, there was someone who said in their comments that they wanted to learn how to build a trusting relationship with their elected officials. And that one sort of I grabbed onto because I think in a nutshell that's what I've learned in the work that I've done in Minnesota and in certainly the work on our Minnesotans United campaign, is that changes happens through relationships and with continual and repeated conversations about hard issues. Oh dear, and my PowerPoint doesn't want to advance. Oh, there we go. So just quickly, that's my Minnesota State Capitol, and that's me walking down the Capitol steps. So here's sort of the perspective that we've taken here in Minnesota. We need to first think about our audience, and as most people, we need to recognize that the people that we'll meet, both in the legislature, in Congress, and on the streets, are going to be from various stages of knowledge and support for single payer, from one end of the spectrum of actively opposing us to the other end of actively fighting with us. And for ease, I've divided people into sort of three camps for myself. There's the opponents, people who are probably not going to change, who are so ideologically opposed to big government or politically it's not feasible for them, that they're probably never going to support us. There's also the movable middle. These are the people that fall between the two ends of the spectrum, who are likely to be reasonable and persuadable if we can find the right arguments that resonate with their own values and their own concerns. And lastly, on the right side of the spectrum are people who support us. Maybe they're currently authors of a bill, maybe they're not, but what they probably need is to be educated and to have the support of their constituents back home so that they can really fight as hard as they want to on an issue like this. So our goal is to meet all these people where they're at and to take them on a journey to greater and greater support for our issue and fighting for it, so that we can push our supporters into the realm of being sort of real champions for the issue, moving opponents to a place where they might still oppose us, but they probably won't fight us as hard, and then moving the middle into the camp of being supporters. So when it comes down to sort of putting this into practice, when you're going to go to meet with a legislator, a congressman, a senator, you know, the first thing I recommend that people do here in Minnesota has been to know what you're walking into, to know where your legislator stands on the issue. You know, Google is an amazing tool. You know, I went into Googled Congressman Keith Ellison and single payer, and here popped up right on his congressional page that he supports a single payer system. That wasn't actually news to me. I did know that, but for other people who maybe you might have to dig a little harder, but it's really important, I think, to know where someone stands before you go meet with them. You know, when I was in the legislative staff at Minnesota's State Senate, it's sort of embarrassing when people come in and say, "Well, you know, I want you to support this," and then your member says, you know, well, I'm the author of that bill, it really helps to have a little knowledge when you're walking into a room. I think it's also really important in your preparation to know where they stand on single payer, but also to know sort of something about them, what committees they sit on, what issues are important to them. You know, a lot of times public information about their families, what have they been doing in the district. All these things can help you build sort of a relationship when you walk into these meetings. So then there's the actual meeting itself. And I think Matt will be able to answer a lot of the questions people might have about sort of the logistics if you're going to the lobby day on Thursday. But generally speaking, you know, I come from a state where we're very polite. We're nice people, Minnesota nice. You know, it's really important to exercise just basic common courtesy, to be on time, to dress respectfully, to be unfailingly polite. It's also important to you know, address the person that you're speaking with appropriately, whether it's a congressman, a senator, a representative. It's nice to know the right title to address them with. And when we send people off to meetings, it's often in small groups, people who maybe haven't met each other before, but who all live from the same in the same district. So I usually have people huddle up, get to know each other, pick somebody who will lead the meeting. If you're attending a meeting alone, obviously that's a little simpler. But so one person needs to take sort of the lead in the delegation to make sure that all the key points get discussed, that the ask gets made. Preferably, there'll be another person that can take notes. So any promises or information you promise to get to that legislator or congressperson, we'll get back to them after the meeting. And that person should also sort of lead the introduction to the group. You know, walk into the room, say, you know, good morning, Congressman so-and-so. We're members of Physicians for a National Health Program, and we wanted to discuss HR 676 with you today. And then have everybody in the room introduce themselves. And I think really important also is people really do want to know where you live. It helps them make a connection to you, helps you find people that you might know in common. So be sure to tell them where you live and what you do. And lastly, I think in the beginning of a meeting, it's really nice to thank the elected official for something. Certainly going to vote on an issue, or they're currently an author of you know, HR 676 or the Senate bill. It's nice to thank them immediately. If you can't think of anything else to thank them for, it's nice to simply thank them for taking time to meet with you that day. And then I like to frame what happens in the meeting as a conversation. And this is really where the art and the science, not the science, of this whole process happens. Personally, I don't have enough confidence in my persuasive powers to believe that I can convert someone in 15 minutes to something that I believe in. So what we have tried to focus on is that what's happening in your lobby visit is really a piece of a longer-term relationship that you're trying to build with this legislator. Knowing that this visit is probably just the first of that work that needs to be done, or if you have an ongoing relationship, it's just a continuation of that work. You know, certainly it's much more challenging for anyone to turn someone down if you know them well, and it's certainly it's certainly easier to get access to someone when you've developed a friendly rapport. So I think thinking of what's going to be happening in this meeting as a conversation versus lobbying, it's sort of a frame that helps me in terms of keeping the right tone in the meeting. And I picked this quote up because I think it really helps focus what I think should be a focus in meetings. At least here in Minnesota, people are very tied to where they're from regionally. You know, facts are easy to forget, but I think stories about people, especially people that are in the districts or the states where our elected officials represent them, those stories are really hard to ignore and forget. So we generally ask people to their lobby visit to try to come up with at least one compelling real-life story that they can tell in the course of the visit, preferably one that is about someone in the district or the state, and a story that will illustrate one of the points that we're trying to make. And I think keeping that in mind, when you have a conversation, it's never one-sided. While you have points that you want to make in this meeting, you know, and our next slide will talk about the key messages that PNHP has set out for you. We also want to hear what they think, and it'll be important for your relationship in the future to know what they think about single payer, what they think about healthcare reform. You know, you can ask them questions. What are your hesitancies in supporting this? You know, what questions do you need answers that would help you support us more? And I'd love to hear from others among you, and use your little chat bar if you have ideas of questions that would be good to tease out those values and beliefs of your legislators and representatives, because I think that would be helpful to everybody. And I pulled out another quote too, this quote from Dale Carnegie, because I think we're in a kind of a particular moment in time, right post all the battles of the Affordable Care Act, because I think certainly there's a great many of us in the single payer movement who haven't supported the efforts of the Affordable Care Act, but I think we need to be very careful that many of the people that we'll be talking with worked very, very hard and defended it over and over and over again, or else they fought it really hard and they're anxious to have it torn down. That we need to be just careful about framing everything in a way that doesn't sound like criticism. Next, these are the key messages that have been pulled together by PNHP Minnesota, or excuse me, not PNHP National. I don't know if you've all received these yet, but they will be in the lobby packet for the day, as well as subpoints underneath that contain some research and some supporting facts for each point. I think one thing to keep in mind is that most members of Congress or members of state legislatures are by necessity generalists. I think it's very easy to talk over people's head when you're talking about healthcare, but I also think it's you need to be careful not to talk down to them either. But I think I would start on a level that that assumes sort of a basic knowledge, but not a ton of insider knowledge. And again, I think any one of these points is best illustrated both by facts, but then supported by stories of people that might be in their districts. Have any of you had patients that have been uninsured? What was those patients' experience? Do you have stories about people who haven't complied with your medical recommendations because of financial barriers they've faced? I mean, those are the stories that will stick in people's minds once you leave the office. And that's what, that's the focus that we've taken. And lastly, again, sort of the critical part of any lobby meeting is to end it with an ask. And these are the asks that have come to me from PNHP. If they've never co-sponsored the bill, can we count on your support for it? If they've sponsored it in the past but aren't current sponsors, will you recommit your support to healthcare for all? I'm just looking at Barbara's question. What problems do you see with this issue? Barbara, could you just tell me a little bit more about that?
Oh,
Why don't
you were asking for suggestions, and I have done a little bit of lobbying, and when I encountered some negative responses, as in anger responses from the opposition, I guess you would say, I'd say, well, what problems do you see with this issue? What is your disagreement with this issue, or what makes you angry about this issue? And usually, I found when they talk out their anger, and I see what the problems are, then it gives me an idea of how to talk to them.
That's great, and I think that's absolutely right on. I think anything that we can do to sort of find out what sort of the core issues are, because I think other than a handful of people, there's going to be a lot of people who are either unsure or are sort of gut level not supportive. So I think kind of testing out to see what are those barriers, what are the things that are keeping them from full support. I think that's great. So asking them about what problems they do see. I'm looking at David's question. We are working to get Jim Clyburn to recommit after sitting on the sideline due to the ACA. Right, so you'd be asking him to recommit his support. Have you talked to him, David, to see what might be his reluctance?
Yeah, we were talking to him when they were working on ACA, and his legislative aide said that because he was the leader, he couldn't be a co-sponsor on everything. He'd made a policy that he wasn't going to do it. But now that the ACA is passed, we saw him last month at the AFL-CIO conference here in South Carolina, and we asked him pointedly, how he felt about single payer and would he recommit, and he said he would. So we immediately contacted his office, and we can't get a word out of him. So now we're trying to get the AFL-CIO to go knock on his door and say, hey, look, we heard you at this conference say you were going to recommit. How about it?
That's great. And that actually is going to illustrate another thing I wanted to say at the end here. And lastly, just sort of to wrap up the concept of the legislative visit or the lobby visit, we have a practice of always having people come back to our main sort of reconvening room and write thank you notes. Thank you notes are a great practice, just because it gives the elected official another chance to see your name and attach it to an issue. It also gives you an opportunity to answer any questions that you maybe couldn't answer in the meeting. Certainly, it's always better to say I don't know and I'll get back to you on something than it is to fill in with knowledge you don't have. So be sure to always say thanks. And lastly, and getting this is kind of to your point, David, is that as critical as the meeting is, I think continuing the relationship is also critical. And this is a picture of one of our med students and a doctor with one of our state representatives. So, it's important, and, David, you said you were at an AFL event and spoke to him as well. I mean, I think ways to continue a relationship after these visits are both, the thank you notes are easy. Attending events where they'll be, like these other kinds of town halls, forums, etc. Communicating with them regularly, whether it's an email, a letter, or one nice way to communicate is also through your local newspaper, thanking or commenting on something your elected official does publicly gets you noticed. They see your name, and they definitely read letters to the editor in their papers. So it gives you another chance to continue that relationship, let them know you're out here working on an issue that that you support or would encourage them to act differently. And the other thing I would say that's really important to continuing a relationship is getting to know their staff people. Staff people are often much more accessible than elected officials, and they're, in my experience, extremely influential. At a state level, in Minnesota, each senator has 2 staff people. Representatives share staff. In Congress, people have large staffs, usually with one person dedicated to healthcare. So getting to know that person and building the same kind of relationship with them often is a great sort of secondary way to get the ear of the person that you're trying to influence. So that's in a nutshell what I had to say. And I'm curious to sort of open it up to hear what other people are thinking, good ideas that you've had from your experiences, things you thought I should have covered that I didn't. And I think, there's few enough people on the call, we could probably unmute and manage you that way, or you can use the chat bar if you'd like.
Hello?
Yes.
This is Scott. I'm just curious if you could talk a little bit more about, especially with the Affordable Care Act, because I know that, especially with Democrats who have sponsored the bill, that their focus is just on implementation, and they may not really be interested in, considering single payer right now or HR 676, because their efforts are focused on the ACA, and I guess how to emphasize the importance of single payer. Like, what would be generally would be your approach?
I'd be curious to see what other people think about that. I have my own personal opinions, and I know if we look at the talking points that PNHP are going to be handing out, one of the main talking point is that the ACA doesn't solve the problem. It doesn't guarantee access to health care, and it doesn't eliminate financial burdens. Has anybody else dealt with this, sort of on a speaking with someone and how they've managed that?
Well, this is David Ball. I did a slide presentation on what still needs to be done after Obamacare, and one of the slides that I use is someone who's run over in the middle of the road, and the president says that we have to be able to do more than one thing at a time, and what I tell people is, yeah, the ACA has done some wonderful things for a lot of people, but there are still half the people that were uninsured are going to continue to be uninsured, and we can't simply stop and say, okay, we've helped some people and we're done.
Absolutely, absolutely, and I think as stories and information come out post-implementation, our arguments will be easier and easier. Certainly, I'm watching the information on the profits of health insurance companies going up in this landscape. The numbers of people that are still uninsured post-ACA implementation. So I think I think there's a delicate line to walk between, thanking people for making healthcare a priority and covering everybody as a priority, but then recognizing that that the deal that was struck is not going to fix all the problems yet. I have a question here from Adam Sorsher. If it's not part of a lobby day event, how do you make the initial approach to a legislator at the state level and at the federal level? If you're someone's constituent, if you're from someone's district, and this would be harder if you're not, but I think you simply call their staff and say, I'm someone who lives in so-and-so's district or state, and I would like to set up a meeting. Certainly on my experience at the state level, anybody who said they lived in my senator's district was top priority, and they beat out any lobbyist, anybody coming in. So if you are a voter, basically, you get first dibs on his time. So I think just set up a meeting and say you'd like to talk about this issue. Does anybody else have thoughts about that?
Yeah, this is Barbara. Yeah, that's what I've done in the past. Is you don't always get to see the legislator, but a lot of times you see the assistant, and if they know you can sit there and take notes as you speak. And you can also do follow-up calls, plus ask other people to do the same, so that the legislator becomes familiar with the issue and knows that other people besides yourself are interested in the issue or concerned about the issue.
Yep, exactly. I'm looking at this. Richard, would you recommend coming into meetings with confidence? For example, single payer is an inevitable. Would love you to support it now while it's growing in popularity, or does that come off as too bold? How do other people react to that? I'm curious.
I think you have to just do what you feel comfortable with. If that's your attitude about it and it sounds authentic from you, then I think you can go for it. That
was sort of my gut level thought too. If that's your belief, you're I think representing yourself authentically is part of being in a is part of developing that relationship. You are who you are. I think demanding that I think that's the demanding them to do something part that would come off as too bold. But if you're saying, I think you should support this now, I think that makes a lot of sense. I think at the same time, you also need to recognize that they're probably not in the same place you are, you know, with some exceptions. So finding out, you know, helping educate them about what single payer is, because I think a lot of people don't understand it, and illustrating, giving some evidence for why you believe it is inevitable would be important. But I agree. I think being authentic is the best thing. Lynn asked a question about her senator's primarily expressed concern seems to be that single payer doesn't promote individual responsibility. What are some good responses to him? I'm sort of baffled because I can't really understand why he would think that. But does anybody else have thoughts about how single payer promotes individual responsibility? I mean, I think one of my thoughts is that right now the system is so complicated that very few people can be the sort of, quote, healthcare consumers that the system seems to require that we be. You know, we don't walk into our doctor's office, you know, as myself as a non-physician, knowing what the answers I need are. I don't know how to be a good consumer or take responsibility in the way that they're suggesting. I mean, I feel for me, my responsibility is to be able to choose my own doctor, and to sort of, you know, I sort of turn the individual responsibility argument into an individual freedom argument, which for me is the freedom to choose my own physician, and from the doctors I work with, freedom to practice medicine in the way that you see fit. And Richard says, single payer enables people to seek the care they need, and I think that's right.
Well, I think
I
part
think
of the
there's
problem
some evidence, I can't encapsulate this well, but there's evidence that in other countries where there aren't co-pays, individual doesn't have the responsibility, they don't see doctors more frequently or abuse that in any way. People are not, you know, really excited in general about going to see their doctor in the first place. So if there's a strain of thinking that if people don't have to pay, then they have too many office visits, but that's not really substantiated by the facts.
That's a good point. I wasn't thinking of individual responsibility in that way, but yes, I think there's a lot of misunderstanding about overuse, and that's certainly the ability to get care that we want. Go ahead.
I think speaking, there's been so many people in the last, I would say, 10 years or so that haven't had good access to healthcare. So in the beginning, maybe all the people that have neglected their health might, you know, there might be a rush to see doctors, you know, if it was to go into, you know, single payer was to go into force, but then it would pan out. It would level off until people felt that they were being properly taken care of, because people are not, I mean, there has been a problem with people going to emergency rooms because they wait until they're very ill or half dead before seeing a doctor because they don't have the money. So I have a feeling that, I mean, I've also seen other videos from Canada and Europe on single-payer healthcare, and it doesn't seem to be a problem of overuse. It's just once people finally have affordable access and take care of the healthcare problem in the beginning, I think in the long run, they say that financially that's actually better than waiting until there's an emergency, you know, until things are really serious. So I don't think it's a big problem that I can see.
Right, and certainly the argument, it's hard to take individual responsibility for your health if you're unable to afford the care that you need. So it's hard to have any use, let alone overuse, if you don't have money to do it. And David suggests that we shouldn't view patients as consumers, and I certainly agree that the whole model of healthcare as a business and patients as consumers is something that we probably need to investigate as a movement and ways to counteract those kinds of messages. But does anybody else have any questions or comments? I appreciate you hanging in there with me in my cold.
Well, regarding that last question, I mean, Malcolm Gladwell wrote a piece about this question of people having skin in the game and having to pay more for their health care. And this has already been stated, but they tend to deprive themselves. They tend to make poor decisions, and they sometimes will decide not to have care that they really need, just as often as they seek care that they don't need. So it's kind of, as you say, that they're not, they shouldn't be thought of as able to be really good consumers. People usually look to their doctors for those kind of decisions.
Right. So it seems like we're kind of wrapping up. I'm happy to talk with anybody individually if they'd like. I'll type in my email address right here. I'm really excited to be part of this organization and to be part of all of you. And good luck, everybody, with the meetings they have coming up. I hope some of you are going to Washington on Thursday, and if not, you're meeting with your state and federal representatives in your hometowns. So with that, I'll just say thank you, everybody, for being here, and good night.
Thank you, Taina.
Thank you so much.
Thank you.
No, thank you.